Good afternoon, everyone. My name is Kanyaporn Ngiwsa. I'm from Maharat, Ratchasima Hospital. Today, I would like to present our research name, Incidence of the Peritoneal Dialysis transfer to Hemodialysis after the free choice dialysis policy in Thailand as a Tertiary center experience. First, introductions. At first, background. In 2008, Thailand has announced the peritoneal dialysis first policy, and it is the first choice for chronic kidney disease patients. And the peritoneal dialysis transfer to hemodialysis requires strict medical and social indications. Peritoneal dialysis penetration surge from 9.5 to 30.7 of the total kidney replacement therapy. And the change in 2020 as a free choice dialysis. For a chronic kidney disease patient can choose both of peritoneal dialysis and hemodialysis options. And the current peritoneal dialysis patient can transfer to hemodialysis by patient preference without any social or medical indication. If that is rapidly increased for a new hemodialyzed patient, it might require the infrastructure, either hemodialysis unit and hemodialysis nurse. The incidence of peritoneal dialysis transfer to hemodialysis upper priorities in Thailand never been assessed. Our study aimed to compare the incidence of the peritoneal dialysis transfer to hemodialysis during the transition from a PD first policy to a free choice dialysis policy. Our methods. Our inclusion criteria at first, a patient will receiving renal replacement therapy or RTs. Second, a patient who switch from peritoneal dialysis to hemodialysis. Third, a patient who age 18 years old or older. And fourth one is a patient who switch occurred between February 2020 and January 2023. For our inclusion criteria is a patient who lost follow-ups. Our trial study is a retrospective descriptive study, and location is in Tertiary hospital in Thailand. Our data collection is in medical record from February 2020 to January 2023, includes bed-like characteristics and patient biochemistry. Our objective first, analyze time on therapy or TOTs, and second one is calculate the incidence rate IR of PD transfer to hemodialysis. And third one is investigate reason for the transfers. And the fourth one is compare overall survival between the PD first era and the free choice dialysis era. Our primary outcome is the incidence of peritoneal dialysis transfer to hemodialysis during the peritoneal dialysis first policy era and the free choice dialysis era. Our secondary outcome is the incidence rate ratio after the policy change and the result of peritoneal dialysis transfer to hemodialysis. Our research result. This table shows the baseline characteristic of peritoneal dialysis transfer to hemodialysis in free choice dialysis policy for the sample size of 71 patients. Between February 2020 and January 2021, the total time on therapy was 723, 760, and 652 persons here in 2020, 2021, and 2022. Respectively, there were 23, 41, and 71 peritoneal dialysis transferred to hemodialysis in 2020, 2021 as a PD first era, and 2022 as a free choice dialysis era. The free choice dialysis era group was compared regarding bed-like characteristics. During the 2020 PD first era, on February 2020 until January 2021, there were 22 cases of peritoneal dialysis transfer to hemodialysis, resulting in an incidence rate of 3.18 per 100% years. In 2021, as a PD first era, on February 2021 to January 2022, the numbers of cases increased to 41 with an incidence rate of 5.39 per 100% years. By the second period of free choice dialysis era, the number of cases further rise to 71 with an incidence rate of 10.89 per 100%. This data indicates a significant increase in the incidence rate of peritoneal dialysis transfer to hemodialysis over the observed period. The transition from the peritonial first era to the fish choice dialysis for era lead to the significant increase in the rate of peritonial transfer to hemodialysis. The incidence rate was 2.52 times higher with 6.57 additional cases per 100% year in the fish choice era compared to the PD first era. Both the incidence rate ratio and the incidence rate difference are statistically significant, indicated unknowable shift in the dialysis transfer pattern. Discussions. This diagram shows the incidence rate ratio doubling after the transition of free choice dialysis policy. For the reasons of the peritoneal transfer to hemodialysis in the free choice dialysis era, patient preference emerged as a new reason for peritoneal transfer to hemodialysis under the free choice dialysis policy, accounting for only 12.8% of peritoneal dialysis cases. Surprisingly, we found a low prevalence of peritoneal transfer to hemodialysis due to the patient preference in the free choice dialysis policy. The primary reason for peritoneal transfer to hemodialysis shifts significantly, with a notable rise in cases due to patient preference peritonitis and ultrafiltration failures. In the free choice era, inadequate dialysis, the most common reason in the PD first era, and decrease in relative frequency over subsequent period. Other reasons such as caregiver burdens, exploratory deprivation, and catheter malfunction become less frequency or more eliminate entry in the later period. For the conclusion, impact of dialysis transition to PD to hemodialysis transfer incidence rate significantly increase in peritoneal to hemodialysis transfer. Reason for transfer for PD first era is an inadequate solute and water clearance. For free choice era is peritoneal dialysis. Patient preference work small, possibly due to the desire to maintain the status and difficulty access hemodialysis unit. Thank you for your attention.
Thank you for such an informative and thought-provoking discussion. So, for the questions and answer session.
Thank you for your presentation. I please to explain how to use of the result for to be the guideline for the patient to choose of the hemodialysis or not.
At first, our aim being to be the advice to the patient with due to the policy change that we can do both of peritonial and hemodialysis, right? I think this information cause the complication of the peritonitis or time survival of hemodialysis can be used to be advice for a patient who first time for dialysis or shoot which one better in inform the statistics.
I'm just wondering, actually, do we have indication for peritoneal dialysis and hemodialysis? The indication for both of them, which are the similar and which are different?
With a similar one is a patient who have a chronic kidney disease or but the different one is if we haven't shipping to the hemodialysis, we don't ship back to peritoneal dialysis because sometimes we first with peritoneal dialysis and we have a complication from the peritoneal dialysis like a peritonitis, so the membrane here cannot be used back. We use back, so we might if we use we choose first for peritoneal dialysis and transfer to hemodialysis, it might be continue to hemodialysis.
Sorry, I mean the first indication, which one to choose?
The first indication which one to choose is we might peritodialysis for like first indication for shoot for like chronic kidney disease. Yes. This one, sir. Sorry. Thank you.
Thank you.